right, now, so we can start this lecture in its entirety here. There'll be two parts, a morning and an afternoon session in terms of taping for the online crew. Okay, now, so you have your prevention of infection, but initially, we're just talking about the big old chart behind me. So that's going to be where your focus is and how it's set up and what is it all about and all that kind of crap. Now, we talked a little bit about these precautions as we went over your pink sheet. These precautions are based on CDC guidelines. I didn't just dream them up one day because I was bored. And the precautions are obviously contact, droplet, airborne, standard, and protective, which is also neutropenic precautions. Now, under contact precautions, you will have those key bold words up at the top in red, and you will have everything that goes under it underneath the column. So that's kind of how it's organized. I have no idea where this came from. It's just that as I have taught this for years, I said maybe 10, maybe 15 years ago, it would be better if I just put this in columns, okay? Columns that make sense. So when we think about contact precautions, we're talking contact. I touched you. Or, here's one that we forget, I touched an inanimate object. So I touched you, or I touched an inanimate object that you touched. You know what that is. That's side rails, call bells, elevator buttons. That's why we never push the elevator button with our finger, ever. We use a knuckle or an elbow, because on that elevator button is all kind of garbage, okay? Nurses who get it, after today I'm sure you will, never go to buffets, ever. Because you would not believe what buffets are cultured from. Like E. coli and all of this stuff. We don't go to buffets. Nurses are just like, oh, no. All right, droplet precautions means just that. Droplets from the nose or the mouth, and they are breathed into the person that is within 3 feet away. And that's why we have the blue couches. Because if you come to class and you're sick, and certainly summertime is not a high time for a peak time for sickness, but if you do come to class and you're ill, or I hear you coughing and sneezing and doing all this nonsense, and it's not allergies, I will direct you to the blue couches. Because look how close you are. You're definitely within 3 feet away. And all of us nurses are really at risk for getting sick, so we're not in the mood to sit by someone hacking up. And you know how it is. They start that coughing, you go, oh my God, I just want to slap her because she's sitting right next to me. I just want to slap the little infection right back to her face. Because you can't. I mean, you just can't believe that they're sitting there doing that. So we have much respect for patients. If we show up to work sick, we got a mask on. All right. Airborne is really curious. Airborne is the worst. It is the most severe, strict precautions we could implement. And essentially, it means that this infectious material stays suspended in the air for more than 30 minutes. For more than 30 minutes. And if you are exposed to the patient for more than 30 minutes, you most likely have a high risk of getting this infection. So airborne is crazy. Airborne also is a little bit complex because many diseases like chicken pox or measles are infectious before you see lesions. So chicken pox, for instance, is infectious for 3 whole days before any child breaks out in the lesions, in the little vesicles. That's crazy. So this is airborne. How are they infected? Airborne. And you know, we had gotten to the point where we didn't see this that much, and my daughter's at Ohio State, and we had a mumps outbreak. That was crazy. Disneyland had a measles outbreak. So again, these are things that you care about. Okay, standard precautions, that's our Jay-Z rhyme. Everything that I just read to you on the pink sheet, the little pink packet is up there under standard precautions. Okay, so, and then protective, you know, private room kind of thing. Now, when we start to help the student understand what in the world is going on with my responsibilities, I came up with like principles. So on your notes, you're going to literally put as a heading, Principles of Infectious Disease Precautions. That's your heading. Principles of Infectious Disease Precautions. And there are so many principles of infectious disease precautions that if you don't know, you're kind of like, oh, I don't think I'm going to get any of these questions right on my exam because I just don't know it, okay? The most important infectious disease precaution is that all diarrhea is a private room. That's number one. All diarrhea goes in a private room under the title Enteric Precautions in some institutions. That's what they're going to have you do, Enteric Precautions. So all diarrhea goes in a private room under contact precautions as well. So diarrhea is contact, it's enteric. If you look at the contact column, you will see some really weird diarrheas that show up in funny places. Shigella, cholera, giardiasis, C. diff, salmonella, VRE, rotavirus, hepatitis A and E. Then there's a little bit of a confusion there. I want to point it out. It says stool incontinence. It's not technically diarrhea, is it? Not really, right? So stool incontinence is really going to be where the patient is incontinent of stool. Patients who are incontinent of stool have a very highly likely chance of having maybe some dementia. And if you've ever had, quote unquote, a code brown, you know exactly what I mean. They've taken the poop and they've put it everywhere. And this inevitably happens at the change of shift. And so you're going to have to go back in that room after you give report, or otherwise the oncoming nurse will be very upset. And so because this patient has a propensity to do this, you want them in a private room. Can you imagine a roommate with this person? So stool incontinence is not diarrhea, but obviously you have to make sure that you kind of include it under those auspices. Now, so that is the number one principle of infectious diseases, okay? Now, the next principle of infectious disease is whatever you need, whatever PPE you need to take care of the patient. So whatever personal protective equipment that you need to take care of this patient is put on before you enter the room. Whatever personal protective equipment you need will be put on before you actually enter the room. If you already work in this, then you have noticed that all of the materials that you need are outside the room. They're all set up, the gowns and all this. So you're putting it on before you enter the room. So that's principle number 2. That's a big deal. Principle number 3 is all PPE is removed before you exit the room. All PPE is removed before you exit the room, except for the N95 mask. Except for the N95 mask. So if you see staff coming out of the room with gloves on, how disgusting is that? They touched the door. That's bad. One of the other things that your place of employment might do that's disgusting is they may have you literally repeat that gown. So they have you hang the gown up, and everybody that goes in the room is supposed to throw that gown on. Raise your hand if you know that happens. Yeah, that's bad. That's really bad. You do not reuse those gowns. You roll them off, reverse them as you roll them off, roll them up, toss them in the linen bin. Don't you be that person. And when you see it happening, stop it. You change the world one person at a time. You can't go in as a bull in a china shop and tell your job what to do, but they don't know what you do once you close the door. So you don't ever repeat that nonsense, right? You're going to roll it off, toss it. Okay, it's just ridiculous. I want you to think what would have happened if that patient had Ebola, and now someone's coming in reusing gowns. I mean, it's just ridiculous. And you don't know, okay? All right, so that's a big deal. So that was principle number 3. Principle number 4 is that the N95 mask, which actually has 4 names, N95, HEPA, which is all capital letters, particulate, and respirator. The N95 mask, which has 4 names, N95, HEPA, particulate, respirator, is going to filter inspired air. It's going to filter inspired air. So if you think about it, we know that we use this mask with TB. The patient's breathing out, you're breathing in. This mask is going to filter that air. Now remember, it must be sized. It's your size. Raise your hand if you did clinicals, you had to be sized for the mask. Okay, the good schools, raise their hand. The good schools should have had you do that. All right, so you get sized for this mask. It's not a disposable mask. You can't toss it, can you? It's your mask, okay? Now, this mask is only for healthcare professionals. It is not for patients. It is not for visitors. It's only for you. It's for aides. It's for doctors. It's for nurses. It's for healthcare professionals. So be careful in selecting this for a visitor. It's not appropriate. And it does not come off until you leave the room. It's the only thing that doesn't come off until you've left the room, because it's reusable. Okay? Principle number 5. Whatever you put on to go into the room, the patient needs to put on to leave the room. So if you put on a gown to go into the room with a patient with impetigo, then the patient with impetigo needs to put on a gown to leave the room. Whatever you put on to go into the room, the patient needs to put on if they have to leave the room for a CAT scan or whatever. Ideally, we would love to keep everything in the room, but that's not practical in some instances. So, you know, patients do have to leave the room. Now, of course, you would not screw this up with the N95 mask because only you wear that. So you got to be careful. Huh? Okay? Don't forget that the surgical/disposable mask, don't forget this, the surgical/disposable mask, which is the kind that most of us pull and put on, and it's the kind that they sell in CVS or Rite-Aid. And so, you know, we use that a lot. That surgical or disposable mask only filters expired air. Can't do anything for inspired air. It's only going to filter expired air. And don't forget, on the same token, that the surgical or disposable mask provides a barrier. So it has two roles. It's going to filter expired air, and it's going to provide a barrier. Because droplets, wet drops, microscopic sprayed drops, droplet, which is who gets this mask, if they hit the mask, it's really protecting that from having gone on your face. I don't know how many times you've been to a concert or even at church and the speaker is passionate about what they're talking about and they're spraying, aren't they? They can't help it, but they're doing this. It's not like they can help it, okay? Or they sneeze or cough or whatever, okay? So this is your ruling guidelines for how we prevent infection, these principles that we just gave you. Now, if you think about it, every single person here today has seen those principles violated. You've seen people come out the room with the gown on. You've seen diarrhea put in a room with whoever. One of you, I don't know if you're here today, you told me such a horrible story about a patient who had had major abdominal surgery, huge wound, in the room with active C. diff, and the patient that had the C. diff was calling out no less than 10 times while you're doing your clinicals to be changed. So this C. diff is in this room with this post-op patient, something that you just, as a nurse, once you know your principles, you should throw up about. I mean, really, this is ridiculous. Okay? Now, before you say, well, Shelly, we don't have any control over where the patient goes. Yes, you do. You have more control than you know. Surgeries don't go back without you saying so. Patients don't go into rooms without you saying so. Admitting has no nursing knowledge. They just put folks where the room is empty. And when it's inappropriate, oh, you better say so. You have absolutely full power over that because you have the nursing knowledge and the judgment that goes with it. Does that make sense a little bit to kind of empower you? Again, you don't want to be a bull in a china shop because one of the things I tell you as a brand new nurse, which I mean, you know, when I say bull in a china shop, they knock everything over. No, no, no. When you're a brand new nurse, and I define that as 6 months on the job, we have a rule in this class: shut up. Just shut your mouth, child. Whatever's going on, shut up. You don't exert the power that you have until after that 6 months. Does that make sense? Have you seen new nurses come in there and talk all kind of smack and act know-it-all, and you know, you just be like, oh, she's not gonna last. She ain't gonna be here next week. Because the preceptor is very offended by you. Don't do that. Learn what not to do. You go to your new jobs, you just shut up. Don't say anything unless some life is being threatened or something is really bad. Okay, just don't do any of this powerful stuff you have until after you've really been somewhere 6 months. And what did you do in those 6 months? You listened, you looked, you watched, you observed. You also built trust. You made friends, but you knew what you weren't supposed to do and you knew what they weren't supposed to do. And if you have a really fun preceptor, you can gently talk about it, but you're not going to tell her what to do, are you? Okay, some of you have very strong personalities like me, and you may want to go in there and, yeah, no, God, no. Don't do that. You'll lose the job before you keep it. Okay, so we went over the principles. Now let's talk a little bit more in depth about each column.